Hi everybody, it's Dr. Magnifico from Jared'sFullVet and Pobly.com. I'm here with Serafina, so it's my Serafina Sunday morning discussion, and I wanted to talk to you guys about what's going on in my life right now. So over the last probably 3 or 4 weeks, both of my parents have been in and out of hospitals and in and out of human health care facilities to try to figure out what's going on with them. They're in their 70s and things are catching up to them. I don't know why it had to happen to both of them at the exact same time, but it did. So I've spent a lot of time with a lot of human healthcare professionals trying to figure out what's going on with both of my parents and navigate through a system that I understand, but I don't quite feel adept at managing the intricacies and the back and forth kind of stuff. So it's really kind of struck me the differences. Although we all have, I say it all the time, we all have the same biology. So really it's the same diseases, the same concerns, the same stuff that goes on with Serafina can go on with humans, really across the board. It's all the same biology and all the same diseases and on and on. So I very clearly understand what's going on with my parents with their medical issues and kind of how things cascade. But navigating through the human healthcare system has been infuriating. It's just been exhausting and infuriating, and I'm sort of always kind of taking a step back and thinking about, oh my God, if we did this in veterinary medicine, one, no one would ever get any help. Two, the cost of care would be so ridiculously high that no one would be able to afford it. And three, there's just this overwhelming kind of ping pong going on. So you have to go to one person to see the next person, that second person. If you can get in days or weeks later, you have a whole 15 minutes with them and then they pass the buck to somebody else. So it's just like this tennis match where you're going back and forth and you never really know who to go back to or where to go or how to move forward or if you're going to see the right person or if waiting all of those weeks for that person is really going to amount to much. And it's been really difficult. I think my parents' health has suffered because they've had to go back and forth so many times and then so much waiting to try to find someone who can help them through not only what's going on right here and now, but how to kind of take that next step. So I really wanted to do this video about how I think veterinarians do it so much better and how we can kind of help our patients and our clients that I just wish we could find the same sort of efficiency in the human field. My case example is that when you walk in the door at Jared's Full Vet, although we can't do everything for you, we can do 90%. We can do the huge majority. We can take your x-rays, do your lab work, help you understand what's going on. We can talk to you about kind of what's going on, where you are, and kind of where to go from here. But more than anything else, we're also here for you if that next step doesn't work. If it either is not affordable, if it's not accessible, if it's not something that you want to pursue anyway, we're here as your backup. We're here to help you from start to finish, regardless of how many other places you go. And there is this continuum of care. More than anything else, there's also this investment in care. And that's what I'm really having a tough time on the human side. I'm not finding anybody who really cares about my parents' little steps along the way. We push you to that specialist, and then if they can't help you, that specialist has to push you to another specialist. It's not like there's someone there to say, I'm gonna help guide you through this process, and I'm gonna make it understandable, and I'm going to make it accessible, and I'm going to make it manageable. There's nobody other than my nuclear family that's invested in my parents' care and helping them understand what's going on and where to go from here, and then also being supportive. And that's what I love about my clinic. I love that everybody at my clinic is invested in your care from day one to your pet's last day on this planet. We are really there for you. You can come back to us no matter where you go, no matter who you meet and whether or not they can help you. You can come back here and we help take care of you. And there's always a team of people dedicated to making sure that you can provide your pet whatever your pet needs. And I don't know where the emotional investment went in human medicine, but it is not there. I have not seen it. Unless you pay for concierge medicine and some private healthcare provider to help, see you through every single step of this process, which is really me because I'm the one in this process that has the medical background. There's just nothing. You just you are sent to the next person who might be weeks away, and they wish you luck, and then they never follow up with anything, and they never follow through with anything. And that's why there's so many extra steps in trying to figure out what's going on and how to get real meaningful help. So my little shout out to veterinary medicine, and in particular my friends and family at Jared's Full Vet, who helped me take care of all of you guys. And my advice to all of you who are not part of the JVC nucleus family: find a veterinarian who's invested in your pet's care and stick with them forever. They may not be the cheapest, they may not be the easiest, they may not be, the open 24/7, like we're not open 24/7 or even 7 days a week. But if you've got someone who's genuinely cares about your pet is invested in their care, don't ever let go of them, because they are far and few between. And I have yet to find anybody in the human health care. Their nurses and doctors are great when you're there in front of their face, and then they're gone. And that's it. You won't find them again. They won't be accessible again. They're not going to help you the next step through. They're going to kind of give you lip service and face service, and then they move on to the next patient. And it's tragic for me to see that so many people, will smile at you and be nice to you, and then they will wish you well and not be a part of the next step or the next part of the process, which is really detrimental to that patient's care. All right, happy Sunday, everybody. I'm going to try to do this weekly. It's my time with Serafina, who always bails on me halfway through. We'll see you soon. Take care. Bye.